Welcome to Ellevate Louisiana's Engage videocast. Ellevate Louisiana was founded in 2020 to empower women leaders throughout Louisiana by connecting and educating them on the challenges impacting our state with data-driven, nonpartisan solutions to make a better future for Louisiana. Hi there, I'm Julie Stokes with Ellevate Louisiana. In today's Engage videocast, we're discussing healthcare access issues relating to various provider types. Our guests include Kathy Kliebert, the former Secretary of the Louisiana Department of Health and Hospitals, who currently serves as the representative of the Louisiana Medicaid Managed Care Organization Association, providing legislative and consulting services for the 5 Medicaid health plans in Louisiana. We also have Traci Thompson, who served over 16 years of experience working as a regulatory and transactional healthcare lawyer, specializing in Medicaid reimbursement and telehealth, serving as the leader of federal and state advocacy for an international health system. Kathy and Traci, welcome to the videocast today.
Hi, Julie.
Hi, Julie. Welcome. Welcome, Traci. And to start off, I'd just like to give an overview of the landscape of healthcare in Louisiana, if that's okay. We'll start with that. Over the last several years, Louisiana, all industries in Louisiana have faced a lot of challenges. Healthcare, however, has been hit harder than most, primarily because of the COVID pandemic, along with the storms and disasters Louisiana has faced over the last couple of years. Onset of the COVID pandemic exacerbated all the problems that we already were facing in healthcare. We have tried very hard to provide affordable quality healthcare to its citizens. We have a significant amount of rural and impoverished residents who cannot get the necessary healthcare for themselves or their family members. And also we have an underserved elderly population. In addition, we've identified at a very high concerning level of racial disparities that must be addressed. U.S. News and World Report ranks Louisiana 46th in the country based on its access to care, quality of care, and the overall health of the Louisiana population. And although the public and private sectors have worked very hard to combat these racial disparities and healthcare disparities so prevalent in Louisiana, there's a lot more work that needs to be done. Including our most vulnerable populations, to assure that they have access to quality care, no matter what their age, their race, financial status, or the location in our state. COVID-19 has shined a spotlight on some of the critical issues facing our state. At Ellevate, we work to support nonpartisan efforts that will help our state to overcome some of the major deficiencies within the healthcare industries. The priorities we have identified have been significant issues for Louisiana even before the pandemic, and of course more so since the pandemic arrived in 2020. The challenges the state faces have made these issues much more critical to the health and well-being of our citizens. Although there are a myriad of challenges that we could address, certainly Ellevate has chosen to prioritize the issue of workforce shortages, which is significant, and Traci, I think you're going to talk about that in just a few minutes. The need to continue to support the growth and utilization of telehealth, which is significant, especially in areas where there's broadband inaccessibility, and also the important issue of long-term care in Louisiana. Traci, you want to take over?
Yes, absolutely. Thank you, Kathy, for that. As Kathy indicated, Ellevate has determined that we have several key priorities to focus on for this year, one of them being the workforce and the shortages that we are experiencing in Louisiana, and obviously those being felt really across the country. Although, Louisiana has had a long history of workforce shortages, it really has been a significant issue that has risen to one of the top issues among our healthcare providers in the state after we began to see the impact of the pandemic and the fact that it really has become such a great problem for our workforce among our caregivers and our caregivers across the state. The state's diminishing healthcare workforce is a major issue that continues to grow and challenge our care providers who do not really have the requisite staff that they need to care for the patients that are really overburdening and coming to the hospitals or to other care facilities to try to get treatment. And then, the staff levels are at such a low rate that they're not able to staff the beds that they have currently to provide the care that is needed. And that is very, very, it's become an urgent thing here in Louisiana, and it's a big, big challenge. Proactive screenings for, that are invaluable for things like cancer prevention and early detection are no longer an immediate appointment away like they used to be. Now patients have to wait 6 to 8 months because of the staff levels that are just unable to be there to make those appointments possible. In addition, providers are being put in the position of trying to match wages that are being inflated to attract the workers that we do have from competitors across the state and across the country. There are staffing agencies and others, flex agencies, nursing agencies that are looking for travel nurses that are offering exorbitant bonuses and high wages to get the staff that is just really needed to be here in Louisiana to help our providers give the care that they need. We are also, because of the pandemic, experiencing worker burnout. Our frontline providers really are experiencing a high level of mental and behavioral health issues because they have been the front lines of this pandemic for a couple of years now with no end in sight. So we really have a lot to do in this area, and this is why Ellevate has really wanted to get in front of this as a key priority. And we are committed to working to continue to support and initiate policies that will address these shortages and that presently limit access to care that's so vital in our state. The other key issue that we have addressed at Ellevate Louisiana is the continuation of the use and growth of telehealth and telemedicine services in our state. Virtual care has become a big priority for our providers, and we have seen that it has really become necessary to the growth and continued care to our residents across our state. With the emergence of COVID-19, the healthcare industry has been required to quickly adapt methods to enable caregivers to provide services remotely to those patients that are unable to either make it to the bricks and mortar facilities or are really not wanting to enter facilities because of the issue of COVID spread and sickness that would entail potentially. There are a lot of emergency policies and regulations. The public health emergency, for example, that was issued on the federal level has given a lot of waivers and flexibilities that have enabled our healthcare providers to overcome some of the barriers to utilizing telemedicine, telehealth services in the past. There have been reimbursement waivers and flexibilities and access flexibilities that have enabled hospitals and patients to access care where they were not able to in the past because of location of either the patient or the provider. So hopefully we will continue to see these waivers and flexibilities continue into the future. And what we have heard this to date, I think, is that the public health emergency will continue. Right now it's set to expire on January 16th, but we have some thoughts from some of our federal government that will continue for another 90 days, which will give us some more breathing room in terms of continuing to utilize these extended parameters to create more access to telehealth and telemedicine services so that virtual care can continue to grow and be a big part of how we reach our populations, whether it's underserved populations, rural populations, or those who are dealing with chronic disease management or others that need to stay at home and receive services via remote patient monitoring or other types of services available through telemedicine or telehealth.
Certainly. This is an area that is very important to me, and I think important to most of us at Ellevate, because it involves our parents and involves ourselves as we age. The care of our elderly population in Louisiana is a significant issue. For years, we have focused on nursing home and institutional care rather than at-home care for individuals, making it very difficult as people age for them to age in place in their homes, in their communities, and instead rely on institutions that many of us don't want. We don't want to go to an institution as we age. And not having those additional options has made it very difficult for us as caregivers as well as individuals to find places that work for individuals in terms of providing care at home, as well as finding nursing homes that have good quality and that can provide the types of services that we want as we age. Ellevate remains committed to finding and promoting policies and solutions that ensure that we care for this vulnerable population as they age. We want to have solutions that allow us to have choices as we get older. It's not to say that nursing homes aren't needed. We know nursing homes are needed, but they don't need to be the only choice in the state. And there have been many reasons that we haven't been able to expand our options for the elderly population. Some of them are political reasons. Some of them are just the fact that it takes a lot of funding. As we have this population that is growing in our state and growing nationally, you need more funding to be able to provide those options. So we want to have options for people where they can, get care at home, where they can go to programs like PACE, which is an all-inclusive program for the elderly, which allow individuals to go to centers during the day and then come at home at night, so that they're not having to have institutional care all of the time. Again, care that most of us don't want. We don't want that institutional care. So it is an extremely big issue, like I said, for most of us. Any of you that have worked to try and find places or options for your parents understand how difficult this is in Louisiana. And I believe very strongly, and Ellevate believes, that there are policies and programs that can work. There are ways to get additional funding into the system so that we can provide those options for those individuals.
Yeah, I mean, I've watched as at least for the last 4 or 5 years that bills have been brought to try to expand access to in-home care, long-term care, end of life. Not even just end of life, but sometimes this can go on for 5 years for a person. I mean, it's not like hospice, it's long-term care. And I see these bills kind of, die in committee every year. Heck, I think last year there was a bill just to have the situation studied that got killed in committee by one of the chairmen of one of the committees. So it's really been kind of surprising. What do you attribute that to?
Well, a lot of it is, nursing homes have been the standard of care, the status quo for many, many years. It's hard for nursing homes to make that change, for people to understand that there are better options out there, that there are ways to fund a program that does provide in-home care without jeopardizing the nursing home system. I think that the nursing home feels very threatened by any changes to that status quo, and have mounted pretty big offensives to assure that doesn't happen. Again, it doesn't have to be that way. It doesn't have to be that we're in a battle with nursing homes. It's simply that we need to look at what options are available, how we can get additional funding into the system, and most importantly, how we can get additional at-home options available for people. It can be done. It just will take some political will as well as some good policy ideas that will allow us to provide those additional options.
And Kathy, if I may, I'll chime in really quick. I did hear that the Louisiana Department of Health has in its strategic plan looked to try to implement the Louisiana Long-Term Personal Care Services Program. I'm not sure if you're familiar with that, but it's just part of their plan for fiscal year 2022, where it's focused on the elderly or the physically disabled adults who either do not need to go to a nursing home or are being discharged from a nursing home, so that these individuals can have some level of care and just more personal services for them to be able to take care of themselves at home or with a loved one at their house as well.
Yeah, the department is under actually a settlement agreement that they have with the Department of Justice to assure that more people are transitioned out of nursing homes, especially those with mental health needs and others that don't belong in nursing homes. And they've put a lot of efforts into that initiative. Also in their business plan, they do have a request for additional PACE programs, the program I was talking about earlier, the program for all-inclusive care for the elderly. That is also in their business plan. Again, those are great options. We need more, but those are great starts to making those options available.
Well, and it's a particularly bad time in nursing homes right now, because I know when I have a close family member who had to go into a nursing home for a little while, more or less for rehabilitation, but she couldn't be visited by anybody because of COVID. So I felt like, gosh, this is going to set her back, losing touch with her reality of all the people she's close to, you know? And, you know, I wanted to mention, though, a lot of people will say, well, a lot of the efforts that go on legislatively are only addressing the Medicaid population, and that they don't necessarily go out to everyone. So if we were to pass more at-home care, it would be for the Medicaid population. And one of my arguments why that would still move the needle for so many of us that are not in that system is that, quite frankly, if you establish a lot more providers out there that can go into homes, it would make long-term care in your home a lot more accessible to people that might not be in the Medicaid system and just can't even find the help, because it's not that easy to find in the first place.
Absolutely.
And of course we do have, and there are additional options when people have individual funds where they can, provide for a sitter, purchase 24-hour care. They do have additional options. However, some people, I mean, even though they seemingly have means, when it comes to providing that level of care, they don't have enough funds. And so some individuals that may not originally qualify for Medicaid, as these programs become available, more home programs become available, they do qualify because of that, the excessive need that they may have. And so they actually end up qualifying for some of the long-term personal care services or some of the other at-home services that you wouldn't typically think an individual will qualify for.
Yeah, because you still need to have help providing those services, because when people don't, you think, oh, $15 an hour, that's about $30,000 a year. No, because that's an 8-hour workday, and we're talking about 24 hours a day.
Right. Well, so, and that's kind of where I think telemedicine, telehealth services potentially could be that bridge, to bridge that gap between having someone come physically and sit in an individual's home. Telesitting, remote patient monitoring, again, are things that are really booming right now in terms of trying to create access to care that is hard to get right now because of, again, the workforce shortages and also just the lack of reimbursement and other things that go into trying to get that care to the level that is needed for the individual.
It's really not just about, making sure that we have, home services available. It's all that other stuff that are the alternatives, like you said, the remote monitoring. And also it's even about things like long-term care reform is also about trying to make sure people understand what options may be available for them in the future, including purchasing long-term care insurance. We don't have a high percentage of individuals in this state that have long-term care insurance. And this is something, especially for middle-income Americans, that can be very, very helpful to assuring that they have options when when they reach that age. So again, it's not just about, yes, we want alternatives to nursing home, but it's really a more comprehensive view of how we can reform our long-term care in this state.
Well, that feeds back to one of my new favorite topics, which is financial literacy, which we won't go into, but so many people don't understand or or they're never trained in all the risks that go on throughout a person's life and making sure that you have the right insurances in place to cover those things. And as a CPA, that's something that like I'm trained to think about, you know. So we have long-term care insurance, but I can't, in my direct family, I probably couldn't find another person that I know that has it. Well, kind of moving from that topic a little bit, you know, we kind of opened up the show with healthcare access. And, you know, I was just having this conversation, and I think Kathy and Traci, you'd be just the right ones to know, but what was our uninsured population prior to Medicaid expansion, and what is it now, roughly, just kind of ballpark as a percentage?
There was a significant expansion. I just will say, I mean, obviously, a Medicaid expansion to give Medicaid coverage to individuals across the state is very important. But I also would say that Medicaid in general continues to be funded at a lower level. So it's still, there is still a significant gap between what the cost of a service is versus what Medicaid actually reimburses for that service. So, you know, even though we're getting there a little bit in terms of trying to provide some coverage, which is a big need, especially for the, you know, the low income and needy populations that we have across the state. But, you know, there is still some monetary needs and funding that should be available at, you know, at some level to try to close that gap so that hospitals and other care providers can continue to provide the care at a quality, accessible level.
Yeah.
And I did find my statistics on it. We were about at 20% uninsured 10 years ago. And of course, since Medicaid expansion, as well as other efforts, we're below 10% uninsured for adults. Now, children, we've always actually done fairly well with children in Louisiana because we covered LeChip, you know, through the LeChip program and other programs.
Right.
So it's not a whole big difference there, but cutting in half the number of uninsured is pretty significant, and it's one of the best states for reducing the uninsured population.
Absolutely.
That's great. So what do you think are the real, like the big barriers to healthcare access in Louisiana?
You want to go ahead?
One of the things that we have that is a big challenge for Louisiana is the way in which our populations are dispersed. I mean, we have a lot of rural areas in Louisiana, so it's very difficult for those individuals living in those rural areas to gain access to care. So that is, I think, a big barrier for us. We have a barrier in terms of our broadband right now, I think, and recently Louisiana has really identified broadband as a big issue, and the Broadband Development Connectivity Office was opened and introduced to try to create a more comprehensive broadband infrastructure to enable connectivity across the state. So I think that we are, you know, looking at that to try to not only get into people's homes across the state, but also to create access from education to healthcare to those individuals living in those rural areas of our state. We're also a poverty-stricken state as well, unfortunately. So there's a lot of disparity with that, a lot of you know, inequities in terms of our healthcare and where our access is. So barriers for a lot of individuals who are impoverished and don't have the means necessary to go and get the care that they need. So I would say that's two. Obviously, workforce is another big issue in our state that we already covered. Kathy, is there anything else that you can?
No, I mean, you know, those were the areas, I think, that clearly the top areas. I think you also have an issue. You have a population, as we talked about, it's an impoverished population. Their focus is not necessarily on preventative health care, right? I mean, that's what we want everybody to focus on. We know that makes a difference. difference. But when you're worried about where your next meal is coming from, when you're worried about, getting to work and providing for your family on a daily basis, the preventative healthcare gets way down on the list. And we did talk about the rural area. One of the big issues in the rural area is just transportation. We have an ability through Medicaid to pay for transportation, but we struggle getting providers that are out there that can, go to those rural areas, pick up somebody, bring them, 60 miles to a hospital or to a clinic and back. I mean, it's not an easy task to find transportation in those rural areas. But I think you definitely hit on, I mean, the rurality of our state, as well as the broadband issue, not being able to access telehealth for those individuals makes it really difficult for access. And of course, workforce
Absolutely.
is so big, and it's not, one of the biggest issues in workforce has to do with mental health workforce. There's a lot of people that need mental health access and can't get it because we have a real problem in terms of mental health practitioners in the state. It's extremely difficult to find those providers.
Absolutely.
When you talk about mental health, it makes me think about telehealth, okay? Because there's an area where you can certainly go sit down with a mental health professional and have a conversation, a therapeutic conversation pretty easily. And I noticed that when COVID first happened, so that second quarter of 2020, telehealth had just blossomed. I mean, I was able to go to doctors in 5 minutes. It was amazing. But I noticed that it's kind of tamped back, and that people don't want to see you in a telehealth setting anymore. I know that we did some things to open up telehealth a bit. What did we do, and what can we do to make it better? But I'm thinking about a consultation that I'm going to next week, and he's literally not going to have to see any part of my body, but yet I have to go over there and sit there and wait for 30 minutes and see him and then go through the driving there to get ready. What's the deal?
Well, some providers still, despite the fact that we've opened it up and given lots of different options, they're still not comfortable with it. They prefer to see you face to face. And until we work on getting more providers that are comfortable with it, and in addition, it's sometimes not just a provider. The individuals have difficulty accessing, a internet access. We talked about the broadband, but it's not just that. Sometimes it's just the literacy of knowing how to do a telehealth visit that makes people uncomfortable. So you have the provider who's not necessarily comfortable, and there are quite a few of those. And then you have the patient that is also not totally comfortable in how to use it. I like you, Julie, think that though it is an answer for so many issues. I mean, whether it's the rural access or just the fact that, I mean, look, if I'm a mental health practitioner, I can see patient after patient after patient via telehealth without having to, worry about, sort of time that people are traveling there and all of that. You even things like, people being late for appointments, they're much more likely to be on time on a telehealth visit. So anyhow, or no shows. I mean, you can contact somebody through the video and get them to immediately, be there for your appointment. But we do have a lot of work to do in terms of, like I said, making people more comfortable. And Traci mentioned the new Office of Broadband. Vineeth who is over that office, is really trying to do some innovative things to help people, be more comfortable. We did a survey on telehealth. We actually have done 3 of them. And one of the biggest barriers is people feeling comfortable with the technology and having the technology, having the actual broadband, and not have it, glitch in and out on you while you're trying to do it, because that ends up frustrating people, and then they don't want to do it again. So he's working on some innovative things to rectify some of those issues as well.
Right. And Julie, I'll just say as well, there are, although we do have a lot of flexibilities and waivers in place, there are still some restrictions that require an in-person visit for the initial visit to then have the coverage and other requirements met under the regulations for telehealth and telemedicine as they stand currently. There are so many pieces of legislation right now that are in various stages in Congress that are trying to make these waivers and flexibilities permanent, because right now, one of the issues too is that they are contingent upon the continuation of the public health emergency at some level. And therefore, there is some uncertainty as to whether or not these waivers and flexibilities that allow this expansion of these virtual care capabilities will continue to exist. So a lot of, I think, providers are looking at this and saying, this is a great thing to do. We want to invest in this, but what if we invest and we expand these programs and then these waivers and flexibilities go away? What will that do for me and the way in which I'm providing services? So I think that within the next year, we're probably going to get a lot more answers to this and a lot more structure around it, where we can look to see more growth in this area. As I do believe, as was indicated by you and by Kathy, this is a major growth point and need for Louisiana, as well as for others across the country, to try to get the services that are vitally needed for populations.
Well, and we talked about workforce, and this movement in the country that we're kind of going through right now, and a lot of people have dubbed the Great Resignation. It's kind of amazing to me. I have a spectrum of thought and feeling on it, all the way from, well, people are just fed up. And also, they've got kids at home that they can't send to school, they can't send to childcare. They've got childcare issues, they've got low pay issues, poor work conditions issues, and then all the way to, how are these people making it? Because you still have to pay your bills. So how does it work, But I mean, regardless of why it's happening, it certainly is a very real issue that we're dealing with. And, when I talk to people at some of the biggest health systems in our state, and I hear the issues with having to postpone, elective scans even, and certainly procedures that are elective. And people think, oh, elective, it must be like plastic surgery or something. No, a lot of times something elective seems pretty daggone necessary when you're on the other side.
A scan is considered elective, right? I mean, in some cases it is. Right. And it's not elective, but they do postpone those type of surgeries because they can wait.
As a cancer survivor, you worry about the impact of this work shortage or employee shortage, on people in early detection, and how many cases are going to slip by.
Well, and I can tell you one of the things that is happening with the younger workforce, because I have children that are, in the workforce that are, in their 30s, and they have recognized that they can work remotely, right? And that there's lots of options for remote work that weren't available before. So for all of my kids, I mean, they have focused on finding remote options, which again leaves shortages in other areas, like people that have to go in to do the scans and to do these, and service organizations. We know restaurants, all of those organizations, people don't want to do that anymore. I can find a job, working at home and be there for my child and those type of things and not have to worry about it. So I find that I had a very interesting conversation with my son and daughter-in-law the other day that just talked about just that. They're both working remotely from home, and they have no desire to do anything but that, and will pursue jobs and one of them is a pharmacist. Right? He's a pharmacist that typically would be in a pharmacy, but no, he's working from home doing, I mean, he does, electronic records and other things, but using his pharmacy degree in a different way and loves it. So anyhow.
And I will say, I think y'all are probably aware, last session, the legislature passed the HERO Act, which is to really help fund and aid the nursing profession in particular. I think it's a 5-year fund that started August of last year. So I know that Louisiana is looking to try to find ways to address this issue, but we have to look kind of across the spectrum as well, because we have not only a shortage of our caregivers, of providers, but also our teachers, nursing, professors and people that are the ones that teach these individuals and allow our nursing workforce to grow and be created within our state are very limited right now. And so the amount of individuals that are able to get into nursing school and then graduate depends on what kind of faculty you have available, and that's low. So it's just kind of
I do think there's going to be a big shift in terms of salaries and other benefits to get people back that into the actual jobs, not, again, kind of like my son, for him to go back into another position, he would need to be in person for it. It would have to be a lot of incentives there for him.
Right.
And so I think you're going to end up seeing some of that shift you've seen it already, like I said, in some of the service industries where these big bumps in terms of salaries and other benefits for those. And I think you're going to continue to see that in nursing and other healthcare professionals, so that you can get some of those individuals to come back into the workforce that have decided, I want to do something else.
Right. And I think that's great for those organizations that can afford it.
Right.
But where does that leave those
I know.
nonprofits
It's going to be difficult.
or other organizations that are serving the Medicaid or uninsured populations that can't afford to pay those big bonuses, to make the incentives that are necessary to get the people back into the hospital or other care settings. So it's kind of a slippery slope there. It's good to have competition, and I think that we need to incentivize them some way, but at the same time there is some downside to it at some level that we need to address, that we don't destroy the opportunities for those entities that may not have the ability to pay those types of higher wages or benefits or incentives.
Yeah. So have y'all heard anything about what the legislature, if the legislature is thinking about doing anything that can help the workforce shortage in healthcare? I mean, I'm not aware of anything.
Only thing that I'm aware of, I know there has been a push for a certain, for instance, in developmental disabilities, there was through the Joint Medicaid Oversight Committee, there was a big push because they were having such difficulty finding individuals to work in their daycare programs as well as in the residential programs. And part of some of the funds that were the federal funds that came down, they did end up sort of using some of those. The legislature made an initiative to the department basically saying to use some of those funds to help with some of those workplace shortages. But that's my only, and again, that's a small segment of the population, but I do know they did put some things in place, some bonuses or some other funding that went to help with that workforce shortage in developmental disabilities.
Right. Well, and I'll just add, I know this is in the past, but in the last few years, the legislature has passed legislation to enable Louisiana to join the nursing licensure compact, medical licensure compact, as well as the physician licensure compact, which allows reciprocity with other states so that physicians can come into our state, hopefully, and nurses as well, and provide services to our citizens without that really sometimes burdensome licensure process that they would have to go through otherwise.
Yeah, awesome. Well, I'd like to close by just hearing from each of you, and you've both really devoted your life to professions that are, you're inherently champions of healthcare, and the alleviation of healthcare disparities. And I mean, what do you see your call? What does your call look like in this job?
I think for me, I'll go ahead and start, Kathy. Early on in my career, even before I went to law school, I worked for a large consulting firm out of DC focusing on healthcare and on best practices for healthcare and for hospitals and health systems. And, I saw at that point that, the healthcare industry, it is so complicated and so complex, but the other side of things, it's a necessity for each and every individual. to be able to live a life, without the illness or other things that may burden them without the care that they need. So I think for me, I see the struggle that providers go through to balance the business of healthcare versus the real, I think, heart of it, which is really care and quality and affordable and accessible care to individuals who need it to live their lives. So as I moved into law school, I really focused on wanting to be a healthcare attorney, and then moving into advocacy work for a nonprofit that had a strong mission in providing care to those that are underinsured and uninsured in areas that were very rural. I mean, you talked about transportation being a huge issue. We had individuals, patients that would ride their bicycles to our clinics to try to get the care that they need. Here in Louisiana, it's just a huge issue. So I've come to this, I guess, calling, as you said, because it is such an issue for our state, but yet there are so many people that are wanting and willing to reach across the aisles and work together to resolve it. So I think with kind of interaction and working together, we can all look towards a brighter future and hopefully better strategies and policies that will enable our state to grow and really become a better foundation in the healthcare industries for our citizens just across the state.
I'm a social worker. That's my background. So, I've always felt like from a very young age that, people just need an opportunity. They need support, whether that's financial or emotional support, to be able to improve their quality of life. I worked for many, many years with people with developmental disabilities and learned so much from that field in terms of the provision of just a little bit of support can help people become independent, help them become financial contributors to their community as well as emotional contributors to their community. And that just, again, a little bit of support can go a very, very long way in improving people's quality of life. And so that's sort of where my background came from, was just, being able to provide a little bit of that so that people can improve their quality of life. At this point, like I said, I've worked with people with developmental disabilities, people with behavioral health issues. My current focus is long-term care and making sure people as they age can get that same quality of life with that little bit of support that they need. And that's my calling, is being able to try and provide, wherever possible, advocacy so that people can improve their quality of lives, whatever that may be.
Well, Kathy, Traci, thank you so much for being with us today. And thank you for your service to Ellevate. I mean, you guys were in as founding members, and you're both on the board, and you're both just dynamic, incredible women that I'm very excited to work with. So thank you so much for being here today.
Thank you, Julie.
Thank you.
Great opportunity. Looking forward to it.
Awesome.
Thank you.
For those of you listening, if you're interested in joining Ellevate or seeing more of our videocasts or podcasts, visit our website at ellevatela.org. That's Ellevate with 2 L's, ELLEVATELA.org. Actually, I think that name was Traci's idea.
Well, I am, a French, the French language has always been a passion of mine. So I studied abroad there twice. So I guess
it's
a little bit of help there.
So thank you so much. Visit our website for upcoming events and to get involved. I'm your host, Julie Stokes, and we'll see you next time.